Some journeys aren't defined by a destination, but by their transformation. From passionate beginnings to defining milestones, the Pakistan Cardiac Super League became the heartbeat of academic excellence. Two pioneers joined forces once again to ignite the spirit of learning and leadership. What began as a challenge became a movement. In every round, a new hero emerged. In every team, a story was written. Now, the legacy continues as 16 elite teams step into the arena to prove their strength, their skill, and their synergy. Team L&H Pelicans, Team SGTH Tigers, Team BVH Cardinals, Team FIC Fighters, Team SICVD Thunders, Team AFIC Lions, Team PIC Hawks, Team Dow Dolphins, Team NICVD Kings, Team RIC Dreadnoughts, Team Looms Falcons, Team MIC Panthers, Team AQH Stars, Team BMC Strikers, Team HMC Stallions, Team PIC Warriors. Guided by the visionary stakeholders of the Pakistan Cardiac Society, steered by the Governing Council, the backbone of PCSL. Judged with fairness and integrity by our panel of expert umpires, and held together by the voice of reason and brilliance, Dr. Hamza Gowri, our moderator, whose pivotal presence made this league a resounding success. Glory goes beyond borders. The winning team will earn a prestigious opportunity to participate in an international cardiology event. Mark your calendars, the battle for brilliance begins August 9th. Pakistan Cardiac Super League, Season 3, the ultimate test of knowledge. Powered by Wilson's Pharmaceuticals.
Assalamu alaikum everyone, I am Syed Hamza Hussain and I am super excited to welcome you all for the second semi-final of Pakistan Cardiac Super League Season 3. We all know that FIC has already booked their space for the grand finale, and today two giant institutions, AKUH Stars and NICVD Kings, are facing each other for the semi-final match. And with this, I would like to update you that this event is brought to you by Pakistan Cardiac Society in collaboration with Wilson's Pharmaceuticals. Moving forward, I would like to introduce the esteemed council members and umpires of today's match. We have with us today's match umpire, Professor Ishaq Saab and Professor Abdul Hamid Siddiqui Saab. And from the governing council, we have with us Professor Hafizullah Saab, Professor Ambarsha Saiba, and more panelists will be introduced during the course of the match. Moving forward, we all aware, I would like to introduce the moderator of today's program. We all aware with the name Dr. Hamza Gowri, and I will request Dr. Hamza Gowri Saab to please start the formal proceeding of today's match. So over to Dr. Hamza Gowri Saab.
Thank you very much, Hamza. It's again a pleasure and for me and for all of us here. And I would like to take this opportunity to welcome you all to this third season of Pakistan Cardiac Super League, which is definitely brought to you by Wilson's Pharmaceutical in collaboration with Pakistan Cardiac Society. We know that we are getting towards the end. We've already had the first semi-final, and the finalists in that match were AFIC Lions. So the Lions are waiting, we all know. And today it is the second semi-final, which is going to be extremely important for the league, for all of us here as well, and for the teams, as we will have the second finalist today. And it's going to be between Aga Khan University Hospital Stars versus NICVD, National Institute of Cardiovascular Diseases, Kings. And as you can see, it is a complete Karachi affair. Karachiites are up against each other. It's quite chilly out here in Islamabad, but I tell you, I feel extremely warm because it's going to be a tough contest. Before we start, I think introductions are extremely important, and our umpires, they keep the pitch alive and all of us awake and ready. And it's the two umpires which have carried the burden. I'll start with Professor Mohammad Ishaq Saab, the evergreen Ishaq Saab. I think he'll be joining us soon. We also have Professor Abdul Hamid Siddiqui. He's always there with a keen eye, and he has just joined us. Welcome, sir. It's great to have you. And we have our governing council members. We have Professor Hafizullah Saab. He's there. Welcome, sir. I see you driving, and you're always there to support us. Thank you very much for your time and your extremely important and valuable inputs. We have Professor Amber Ashraf. You know, ma'am has been a pillar for this league. And she's always been there supporting each and one of you out there, and she's always guiding you all the way through. We'll be joined by Professor Feroz Memon Saab, again extremely instrumental in the league, and it's always great to have him. We also have Dr. Jamshed Ali. He's the coach of Aga Khan University Hospital. I think he's also there. So welcome to the governing council members. I think we'll have more introductions as we move forward. So now getting to the real thing. We have the two teams, and I believe the teams are ready. And I will request the captains to start with the introductions of their teams, and we are going to start randomly with Aga Khan University stars. Okay, I can see them. Captain, go ahead.
Assalamu alaikum everyone, here 𝐾 stars here. My name is Dr. Hassan, I'm the captain. I have my team here with Dr. Aisha.
Assalamu alaikum, Aisha Women Cardiology.
Assalamu alaikum. I'm Dr. Fahad, final year cardiology resident.
Assalamu alaikum. This is Anna, final year cardiology resident.
Wa alaikum assalam. Welcome to you guys. And are you ready for the game?
Yes, we are ready.
Okay, best of luck to you. All right, can we have NICVD Kings? Yes, I see them. Introductions, please.
Assalamu alaikum. I'm Dr. Farhan, captain of NICVD Kings. I have Dr. Osama and Dr. Neelam and Dr. Javeria.
Okay, so welcome to the match. It's the semi-final. The finalists will be decided, and I'm sure you're all geared up.
Yes.
Okay, so best of luck to you, to both the teams, and may I have the permission, sir, to start with the proceedings? Okay, so now the conditions, the weather looks pretty good. Conditions, yes, I see a lot of bounce, maybe variable bounce. It's a grassy wicket. So both the teams, you have to play it wisely, but we are always looking for a good total, a big total. So best of luck to you. And with this, we move to the all-important coin toss, which is going to be done electronically. And randomly, I'm going to select one. So NICVD Kings, what would you like to have, heads or tails?
Tails.
So they've gone with tails. Roll the coin, please. And it's tails. Oh, brilliant. So that's a good start for them. And NICVD Kings have won the toss. Tails it is. Okay, you've got two questions, as we all know. First one, do you want to throw the questions or you want to take the questions?
We want to throw the questions.
Okay, throw the questions. All right. And which case would you like to pick? Case A or case B?
We want to pick case B.
Case B. Is that right?
Yes.
Okay, so the news from the center is NICVD Kings have won the toss. They want to throw the questions and they have selected case scenario B. All right then. The stage is all set. Second semi-final. Let the games begin. So that's the first scenario. Please read the scenario, Kings. It's all yours.
Yes. A 72-year-old man with heart failure with reduced EF from ischemic cardiomyopathy, EF 28%, present with worsening exertional dyspnea, orthopnea, and exercise intolerance despite GDMT. Findings: echo shows severe functional MR, EROA of 0.45 centimeter square, regurgitant volume 58 ml, 𝐿VEDD 72 millimeters, RVSP 64 millimeters mercury, TEPC 14, RV mildly impaired, net pro-BNP of 7,800, cardiac index 2.1 liters per minute per meter square, wedge pressure of 30 millimeters of mercury, on maximally tolerated beta blocker, ARNI, MRA, SGLT2 inhibitors, frailty score intermediate, and coronary anatomy unchanged, PCI 2 years ago. Our team is considering transcatheter edge-to-edge repair, mitral clip versus surgery versus medical therapy alone only.
All right, thank you very much. So, Stars, you've got a couple of seconds to get ready and then just let me know. And I'd like to welcome Professor Feroz Memon. He has joined us. Welcome, sir. It's the second semi-final. Let's see how it goes. All right, Stars, are we ready?
Yes, we are ready.
That's wonderful. So, can we have the first question on the screen, please? Go ahead.
Single parameter most strongly predict benefit from transcatheter edge-to-edge repair. RVSP of less than 70 millimeters of mercury, EROF 0.40 centimeter square or more, and LVEF of more than 20%, LVEDD of less than 75 millimeters of mercury, PASP of less than 60 millimeters of mercury.
All right, your 60 seconds start now.
यार देखो RSVP तो मेरा नहीं ख्याल कि हमें ओपन करके करना है. हाँ, तो ओपन में डिस्कस. यार देखो
EROA should be the one that gets better with TER.
स्ट्रॉन्गली विल बेनिफिट. तो टीयर जो है उसके जो दो कस्प हैं उनको माइट्रल क्लिप हम करेंगे तो उसका इफेक्टिव ऑरिफिस एरिया कम होगा. तो आई थिंक इफेक्टिव ऑरिफिस एरिया ही मोस्ट स्ट्रॉन्गली प्रेडिक्टर है कि उसका बड़ा हुआ होता होगा. हाँ, इट इज और नॉट.
25 seconds to go. Looks like an in-swinger. Let's see what goes.
बाकी सब तो नहीं हो रहे. तो लेट्स गो विद बी. क्या कहते हैं?
15 seconds. 10 seconds, Stars. Come on.
We'll go with B ball.
B beta. Okay. You want me to lock B beta. And let's see how it goes. So lock B beta. And that's a brilliant start. Beautiful 6. And this has been flicked wonderfully well over the square leg boundary for a 6. That's a wonderful start. Great going. We're getting excited here. All right, can we have the next question? Question number 2 on the screen, please.
Which factor strongly predict futility of surgical mitral valve repair? Age more than 70, and diastolic diameter of more than 70 millimeter of LV, and TEPC is 14 millimeter, EF 28%, EROA of 0.45.
All right, start the timer, please.
और देखो टेप्स फ्यूटिलिटी ऑफ सर्जिकल मैटर रिपेयर कह रहे हैं. मैटर रिपेयर कर दिया है लेकिन उसका फ़ायदा नहीं हुआ. वो तो टेप्सी है, वो तो सिर्फ जस्ट हिंड्रेंस है फॉर सर्जिकल मैटर रिपेयर कि हम कर नहीं पा रहे. हाँ, तो वो कह रहे हैं उसका फ़ायदा नहीं हुआ. मेरे ख्याल में एंड डायस्टोलिक डायमीटर है बिकॉज वो एलवी डायलेटेड ही इतना है कि आप रिपेयर सर्जिकल कर भी दोगे तो उसका फ़ायदा नहीं होगा. हाँ, मेरे ख्याल में तो एंड डायस्टोलिक डायमीटर स्ट्रॉन्गली
20 seconds to go.
मेरे ख्याल से ये बनता. I think let's go. We'll go with B beta.
Okay, so again, I think you want me to go with B beta. So what, did you have B's in breakfast or what? B beta. You want me to log it?
Yes, yes, please.
And I don't have to ask you, but you seem to be pretty sure, right?
Yes.
Okay, then lock B beta. Oh, goodness, that's the first blemish. Oh, you're pretty sure, but never mind. So they got this one wrong, but that's all right. They still have 8 more questions to go, and there's a long way to go. With this, we move to question number 3.
Which intervention best reduces pulmonary pressure before reassessing valve strategy? high dose
Gentlemen,
diuretic,
this is pulmonary
8
pressure before
varicigoates, increase RNA dose, IV nitrates, and inhaled nitric oxide challenge.
All right, your timer starts now. 60 seconds are on the board now.
नहीं वेरिसिगॉट भी नहीं है, आर्नी भी नहीं है, नाइट्रेट्स भी नहीं है. आई थिंक इनहेल्ड ही है. आई थिंक इनहेल्ड ही है जो सबसे पहले हम वो करते भी हैं. रिड्यूस प्रेशर, बेस्ट रिड्यूस, सबसे ज़्यादा रिड्यूस किससे होता है? तो आई थिंक इनहेल्ड NO से ही होता है.
एक मिनट, which intervention best reduces pulmonary pressures before reassessing valve strategy? तो diuresis से PCWP गिरेगा ना?
पल्मोनरी प्रेशर तो नहीं गिरेंगे.
5 seconds to
पल्मोनरी
go.
प्रेशर किससे गिरेंगे?
अब pulmonary pressure से secondary to LVDP बढ़ा हुआ है तो PCWP गिरेगा और diuresis आपको क्या हो गया है?
15
मेरे ख्याल में तो
seconds.
इनहेल्ड NO चैलेंज है.
बात सही मेटल बॉल की बात हो रही है
हाँ तो डायलिसिस
10 seconds now. Stars.
हम सही समझ रहे हैं या नहीं समझ
6, 5, come on.
We'll
Answer.
go with alpha A.
Okay, so just at the last moment, just 2 seconds to go, and they say A alpha. That's what you want to go with. A alpha.
Yes, please.
It's is it unanimous?
Yes, please.
Okay, they say A alpha. Lock it. And brilliant. That is superb play. I think your team member, she got it right. The credit goes to her. She kept at it. Brilliant answer. Great work, Agha Khan. And especially, this is where the captain, he had to listen to one of the players, and she was so convincing. So great job. Well done. Yeah, good to see that. Okay, with this, we move to question number 4.
Which finding most supports transcatheter edge-to-edge repair over surgery? A. Severe LV dilation. B. Mild RV dysfunction. C. CL 2.1 liter per minute per meter square. D. MR EROA of 0.45. E. High frailty score.
All right, you have 60 seconds to answer.
For in this case.
Mild RV
In this case ही है क्योंकि 2.1 और ये सारे उसी के हैं. तो यार हाई फ्रेलिटी तो इसका है नहीं, इंटरमीडिएट फ्रेलिटी है.
अब इस ये चीज
तो यार डायलिटेशन है.
यूज कर रहे हैं मतलब
नहीं,
ये हमारे
confuse कर रहे हैं,
ये इस
it's
case है.
dysfunction.
मेरे ख्याल आरबी डिस्फंक्शन है.
पहले वाला में
आरबी
कोई बात
डिस्फंक्शन ही
नहीं
है. तो वही उसी को
मेक श्योर करो देखो अच्छा
नहीं ये 2.1 भी इसी का है.
ठीक है फिर ये CI तो वो हो गया ना
हाँ कार्डियक इंडेक्स भी इसी का
तो ये तो इतना बुरा नहीं मतलब ठीक है
हाँ तो मैं
25
माइल्ड आरबी
seconds to go.
डिस्फंक्शन ही. तो
So that's a slow moving delivery. Let's see what we get. 15 seconds to go.
नहीं था ना
तो
9
we'll go
seconds
with
stars.
beta B beta.
You really like B's, B beta again? Okay. Should I lock it?
Yes please.
I like the way you guys discuss. So lock B beta. Let's see. Oh no. So the B's.
So just one thing. This we are talking about this case. Just go back on the case. It says intermediate frailty score.
Can we have the score? Can we have the scenario,
Yeah.
please?
Yeah.
Bring
Can
the
we go back
scenario.
to the scenario, please?
Yeah, they are bringing the scenario.
Frailty intermediate था ये इसमें है ही नहीं. So we going back. Frailty score intermediate. It doesn't qualify in the question and the case does not fit in. So it's not our fault. The question is wrong.
Okay, so can I have the next one, please? Yeah. So, okay, so I think I'll take the umpires on board. So we have, do we have Professor Ishaq Saab there or Abdul Hamid Siddiqui Saab?
Yes, I'm around.
Sir, I think you'll have to help us with this one. So you can have your query forwarded to Abdul Hamid Siddiqui Saab. Go ahead, stars.
I think looks like in the question, as he has pointed out, it's the intermediate frailty score. So from that point of view, I think his objection is valid.
Yes.
So I think we have to refer to the examiner who compiled the scenario.
Yes.
So we can invalidate this question. We can have an extra question just to address their query.
So should we have a repeat question, sir? I think, yeah?
Yes.
Okay, team, technical team, can we have it done? Okay, I think considering that this is an important game and this one definitely is a controversial question, we need to have a second question lined up for this. So, technical team, can we have the next question? 11th. Okay, so we want to do it afterwards? Okay, so I think you'll have an extra question in the end, right? So we'll continue with this. Right now, this stays on hold and we'll take the next team on board. All right? Sir, Abdul Hamid Siddiqui Saab, I think this is how we'll do it. You're happy with this?
I think it's absolutely fine.
Okay. Thank you, sir. Thank you very much. So, okay, teams, hold on. So, moving to the next question, please, which is again going to be question number 6 here as we'll go to the 11th question. So, can we have it on the screen, please?
Yes. Which best explains the development of severe secondary MR in this patient? Annular calcification.
Okay, hold on. I think answering team, stars, you'll have to mute yourselves. Discussions afterwards. The next question is ongoing.
C
Okay.
is restrictive leaflet motion from LV remodeling. D is papillary muscle ischemia. E is rheumatic involvement.
All right, the timer starts now. 60 seconds.
So देखो इस केस में जो बन रहा है ना इन दिस पेशेंट, तो इन दिस पेशेंट में जो मैकेनिज्म है वो
डायलेटेशन हो रही है ना एलवीएस की वजह से, तो रिस्ट्रिक्टिव
हाँ वो उसकी एलवी रीमॉडलिंग की वजह से ही है।
इसका देखो एनुलर डायलेटेशन होगी तो फिर लीफलेट का
जो पेपली मसल स्कीमिया है ना वो क्यूट होता है, वो क्यूट होता है और मसल रप्चर और उसमें जाता है।
लॉक सी अगर सबको खाना खिला।
We'll go with C, cat.
Okay, you seem to be pretty confident. C, Charlie, or cat, whatever. So you want me to lock it?
Yes, please.
Okay, he's saying lock C, Charlie. Lock it then. And he's absolutely right. Great answer. Very well done indeed. Superb. So that's great goings. They're really digging deep into the questions, discussing it well, and they're coming up with the right answers. So that's good. Good to see that. Okay, we are moving to the next question now, which is going to be technically question number 5.
Which trial best demonstrated the mortality benefit of transcatheter H to H repair in functional MR? A. Mitra FR, B. COPT, C. Everest 2, D. CLASP HD, E. Reshape HF.
Okay, 60 seconds. The timer starts now. So that's the finger spinner into play now. Let's see how they negotiate this one.
Multiple benefit I think कोएप में था। देखो इन दो में से कोई एक है, एवरेस्ट और क्लैस्प रीशेप में तो नहीं है।
एवरेस्ट था ना, एवरेस्ट का तो माइक्रो एफआर और कोएप इसके अंदर है यार। कोएप में बेनिफिट मोर्टेलिटी बेनिफिट
25 seconds.
मेरे ख्याल में कोएप ही है।
कोएप लॉक कर दो, मतलब मुझे याद है कोएप में मोर्टेलिटी बेनिफिट था।
माइट्रा एफआर में आई डोंट थिंक सो था।
15 seconds.
We'll go with B, beta.
Okay, so you want me to lock B, beta. I think again it's a B. So you've come down the wicket going for the mid-off boundary for a 6. So your team member thinks it's definitely this one, the COAP trial, right? He says yes. Okay.
I think so.
All right, we are all hoping so. Let's see what happens. Lock B, beta. And it's a superb answer. The moment he said it, he was right on the money. Wonderfully done. Wonderfully done. Brilliant play. Superb. That's great going. Great teamwork. All right. Now moving to the next question. Technically, question number 6 coming your way.
The primary mechanistic reason Mitra FR failed to show benefit from TIR while COP demonstrated clear benefit was COP mandated higher ERO threshold than Mitra FR. B. Mitra FR enrolled patients with markedly large LV volume where MR severity was proportionate to LV dilation. C is Mitra FR used substantially less GDMT than COP. D is COP included lower risk younger individuals. E is scoped has had significantly fewer procedural complications.
The timer starts now. 60 seconds is what you have.
क्वेश्चन नहीं आता होता ना उसमें मेरा एक वो मानना है कि उसमें सबसे जो बड़ा आंसर होता है वो वाला आंसर होता है.
लंबा आंसर ही सबसे सही होता है.
कंसीडरिंग हमारी जो हिस्ट्री है
बी सही जा रहे हैं.
बी
देखो reason to pick. I'm really sorry. Let's intellectually proceed because ये क्या
I think ये
देखो
let's read it. कोई higher ERA thresholds थे या enrollment है. हाँ तो ज़्यादा फायदा होगा ना.
दैट इज व्हाई रिजल्ट नहीं आएगा.
25 seconds.
अच्छा हम रूल आउट करते हैं. ई निकाल दो. ई कुछ
लेकिन लेजर एलवी वॉल्यूम्स होंगे तो फायदा कम.
15 seconds.
मेक सेंस.
हाँ तो सही है. तो मेरे ख्याल में बी बन.
निकाल दो. अब हमारे पास ऑप्शन बचा ए. मुझे
9, 7, 6, 5.
We'll go with B beta.
Oh my God, B beta again? Okay, they really like B betas. You know, it's so interesting this time around. You come with logic, you come with preparation, but you guys, you're actually observing the patterns. And, this is brilliant, and brilliant logic that he came up with. Let's see whether it was brilliant or it wasn't. So we're going to lock B beta, and let's see. Lock it. Oh wow, superb! Man, this is unbelievable. क्या हो रहा है ये?
Great, that's the point.
Superb. Ma'am, they are going beyond the realms of basic knowledge and preparation, because they are now observing the patterns which are being followed. This is scary for the examiners and everybody else.
Exactly.
So superb answer. And with this, we've already had 6 questions and you've just lost 1 question. So brilliant. It's a score of 30 already. We are moving towards a very decent total. Let's see where we end up. With this, we move to question number 7.
In COPT, what was the major predictor of tear non-response? A. MR EROA of less than 0.30, LA volume more than 60, PSP of more than 60, D is RV dysfunction, E is LVDD of more than 70.
All right, you have 60 seconds. Answering team, unmute. Stars. I can't hear the stars.
ये कोएप्ट है तो इसमें उन्होंने मेजर नॉन रिस्पांस पूछा.
जो पिछला क्वेश्चन था ना उसके अंदर एग्जैक्टली यही हमने कहा था कि 72 एंड डायस्टोलिक जो वॉल्यूम था वो 72 से ज्यादा था. इस वजह से
माइट्रा एफआर में बहुत ज्यादा लिया है ना.
तो इसके अंदर भी यही था कि बहुत ज्यादा जो था
तो उस पर ज्यादा फायदा होगा.
एंड डायस्टोलिक वॉल्यूम था ना दोनों के अंदर. जो माइट्रा एफआर था उसके अंदर था उसका
20 seconds.
जो
हमने लास्ट ये बोला है कि
15 seconds.
You're sure about E?
10 seconds. Stars, come on.
यार बी बिल्कुल गलत है. ए बी
6,
We'll
5.
go with E elephant. E elephant.
Okay, this time we have an E epsilon or elephant. Really, that's the first one in this match so far. E epsilon. So I'm going to lock E epsilon. Let's see what happens. Lock it. Oh, superb answer. You guys are really going great guns. Wonderful. Blue scrubs, light blue scrubs, going great guns at the moment. Superb. Well done. Very well done. So, they are moving towards a pretty decent, I would say more than decent total, because it's just one question that has actually gone wrong. And I'm sure that NICVT Kings are also gearing up, and I'm sure they can do it. But still, we still have 3 more questions to go. So let's see what happens. Question number 8.
Which trial supports aggressive GDMT optimization before mitral intervention? A. Shift, B. Paradigm HF, C. Emperor preserved, D. DAPA HF, E. All of above.
All right, you have 60 seconds, and let's see what happens.
शिफ्ट और एम्परर बचे. अब बताएं. ऑल ऑफ द अबव निकल गया.
ऑल ऑफ द अबव भी निकल गया.
That's a bouncer, I would say. Let's see how they deal with it.
इंटरवेंशन की बात कर रहा है. शिफ्ट रह गया ना. ये पैराडाइम एम्परर डापा तो है ही नहीं.
पैराडिज्म एफएच वो भी इसका नहीं है.
पैराडाइम तो आर्नी का है.
एम्परर प्रिजर्व्ड किसका था?
एम्परर इज एम्पा और डापा इज डापा.
But none of us these are about valves,
हाँ,
right? And all
valves
of the above गया क्योंकि वो नहीं है. So should we shift?
I think shift है.
25 seconds to go.
बन तो यही रहा है. या तो सबने ही GDMT को support
लेकिन
किया ना.
MR intervention before, हाँ, that's for heart failure.
Not from
हाँ.
mitral intervention.
15.
Thinking correctly.
तो मेरे ख्याल में तो A होना चाहिए वैसे. Let's go
एक
with
मिनट, does it
9,
talk about cause
We
dependent?
don't have
8,
time.
7, come on. 5.
We'll go with A alpha.
A alpha. Okay, so how sure are you?
Not very sure, but we took the.
Okay, so I think it's not very sure. Let's see what happens. Maybe it's just a guess, but let's see where it goes. Lock A alpha. Oh, goodness me. I think somebody talked about it there. Somebody was using more logic. And yes, because we all know where these trials are coming from. So heart failure, we all know. And yes, so again, the teamwork, somebody at times knows the answer, but then you have to pick one. All right, you've done pretty well. Second last question coming your way.
Which imaging parameter independently predicts survival post-tear? A. TEPC, B. LVDD, C. EROF, D. LA volume, E. RVSP.
LA volume RSV.
60 seconds.
बाकी से बहुत late गिरेंगे.
Yeah, I think ER हो गया. तो ये I think ER हो गया.
But अगर यार OA is the first thing to become better, ठीक है? But survival उसी के साथ related है.
हाँ, survival severity सबसे ज़्यादा उसी के साथ होती है ना, ER OA के साथ होती है. वो कम होगा तो MR कम होगा, MR कम होगा तो फिर सर्वाइवल बेहतर होगा. मेरे ख्याल में तो ये है. और क्योंकि LVDD, TEPC.
25 seconds to go.
तो I think so. I think C ही है. RS.
15 seconds.
Pressure. I don't know. So let's go with C.
10 seconds, come on. 6, 5.
We'll go with C Charlie.
Okay, they want to go with C Charlie. So again, I see them a bit confused about things. Again, I think it's guesswork if I'm not wrong, but there has to be some logic somewhere. Lock C Charlie. Oh, so you were pretty close to it again. But this was a difficult one. It turned the other way. Again, well done, well played. At times you don't get the outcome, but you think in the right direction. Okay, so score is 36. This is your last chance, last question to improve on things. Let's see whether we go beyond or into the 40s. That's going to be a good total, considering the pitch and the conditions. Okay, last question coming your way.
Which study demonstrated that pulmonary hypertension strongly modifies tear benefit? A. COP, B. MITRA-FR, C. GUIDE-HF, D. TOPCAT, E. EMPEROR reduced.
देखो एम्परर रिड्यूस तो नहीं है क्योंकि वो तो एम्पा का है. ठीक है.
Okay, so your 60 seconds have already started. Let's see.
MITRA-FR है या कोएप्ट है. इन दोनों में से कोई एक है. कोएप्ट ने तो फायदा हुआ था.
Kindly on the timer.
Higher LVEDD वाले उठाए थे ना?
Yeah, the timer. Yeah, so please switch.
जिसने LVEDD ज़्यादा उठाया होगा ना, उस मरीज में naturally pulmonary hypertension worse होगी.
So I think we'll deduct 10 seconds from it. Yeah.
मेरे ख्याल में तो कोएप्ट.
25 seconds to go. Come on.
MITRA में तो फायदा शो नहीं हुआ था. So I think we'll go with A alpha.
Okay, A alpha. So you want me to lock A alpha? You're sure this time?
Yes. Unfortunately, after very long time.
Yes.
So, yeah, I think you still have a good chance, and I think you guys are really going for a big stroke this time. You look pretty confident. I don't know what happened, so I'm going to lock A alpha now. And super! Absolutely brilliant work. They knew what they were talking about, and I could see that in their eyes. So well done, very well done indeed. And with this, we've now come to the end of this first innings of the second semi-final. And the score is 42. Yes, we are into the 40s in this game. And that means they've only lost 3 questions. So the other team has to improve on that. And they can only get 2 questions wrong. If they repeat the same performance, we are getting into extremely exciting super over, the knockout stage, and we don't know what happens in that. So let's just hope that we come up with the goods. I'll definitely take our panels of expert on board. We have our umpire, Professor 𝐷.𝐈.𝐂 Siddiqui Saab. Sir, your thoughts?
I think very fighting score that has been put on by AK US Stars, and let's see the response of the NICVD Kings.
Thank you, sir. He is excited by the response. I can see that. And we have Professor Amber Ashraf, ma'am.
Thank you, Hamza. It's really a very exciting discussion, which I've enjoyed basically. That's wonderful. And it shows the teamwork is very important. And with a good interactive team, we always win and achieve our goals. Thank you very much.
Thank you, ma'am. Definitely. I think it's such a wonderful competition going on. The pitch wasn't that easy. They were coming up with logic. They were thinking about things, and in fact, they were going beyond logic and knowledge at times, and that showed. But it's a good total. We also have Professor Feroz Memon Saab. Sir, is he there with us? Feroz Saab? So I think we can't hear him. He's probably not there. But we also have the coach of Aga Khan University Hospital, the Stars, maybe, for this match. We'll see in the end. But they're always, like stars. They play so well. And we have Jamshed Ali Saab. Dr. Jamshed, are you there?
Ji, I am here.
Sir, your input, please. How do you feel now?
So, I think a very tough case, but my team did really well. काफी टफ टॉपिक था, but I think काफी अच्छा कर लिया. Let's see how the other team does.
Very right, ji. बिल्कुल.
Thank you for the support.
मुश्किल टॉपिक था, but I think it's coaches and mentors like you who are always there with the teams. They're training them, guiding them, supporting them, and being there is so important. So that's great to see, and best of luck to you. And I just hope that NICVD Kings, are you there? You ready for your turn?
Yes.
Yes, so best of luck to you. You can do it. You never know what happens in the end. Keep fighting till the end. And with this, we now start the second innings. Can we have the case scenario? The vignette on the screen. Okay, Stars, go ahead.
So case number A, a 59-year-old man with non-ischemic dilated cardiomyopathy, EF 22%, presents with progressive dyspnea, orthopnea, 3 kg weight gain, and new runs of non-sustained VT on Holter. He is on sacubitril valsartan of 97/103 milligrams BID, carvedilol 25 milligrams BID, spironolactone 25 milligrams daily, and DAPA 10 milligrams daily. His cardiac MRI showed mid-wall LGE of basal septum and inferior lateral wall, ECV extracellular volume to be 36%. The normal ranges are given 20 to 30%. A pro-BNP level of 5,850, baselines to 100. Right heart cath reveals pressures as follows: RA 13, PA 52/28, mean 36, PCW 26, CI 1.9, blood pressures 104/68, creatinine 1.7. Baselines 1.2. The QRS is around 118 milliseconds, non-left bundle branch block morphology. He remains symptomatic despite maximally tolerated GDMT.
All right, Kings. So you have a couple of seconds to gather yourselves. Let me know when you're ready. All right. So,
yes, we are ready.
Kings, you're ready?
Yes.
Okay,
Yes.
best of luck to you. And can we have the first question on the screen, please?
So question 1, what is the most plausible dominant mechanism for his recent heart failure deterioration? A. Increased afterload due to neurohormonal rebound from ARNI, subclinical myocarditis transiently impairing systolic function, decline in renal perfusion reducing GDMT efficacy, progressive fibrotic remodeling increasing myocardial stiffness, worsening mitral regurgitation from annular dilatation.
All right, we are going to start the timer as you have 60 seconds to answer this.
Fibrotic 36% and decline in renal उसने मेंशन नहीं किया उन्होंने सब क्लिनिकल में इसका भी कोई नहीं दिया क्या
25 seconds to go.
fibrotic show करते हैं ना लेट बटन D.
Come on, 12 seconds.
We'll choose D delta.
D delta. So you're sure about it? Should I lock it?
Yes.
Okay, they were discussing quite silently, but they seem to be pretty sure about it. Lock D delta. And yes, superb answer. Brilliant start. That's what we were looking for. Great going. That's a wonderful 6. Oh yes, went like a bullet when you hit that one. Good stroke. Okay, question number 2 coming your way.
So question number 2, which intervention would provide the most immediate clinical benefit? A. Increase ARNI dose. B. Start hyaluronidine isosorbide dinitrate. C. IV loop diuretics with low dose inotropic support. D. Add midodrine to support GDMT. E. Urgent advanced heart failure therapy listing.
Start the timer, please.
ये पहले ही मैक्सिमम जीडीएमटी पे है सही है तो इंक्रीज आर्नी डोज तो नहीं होगा हाइड्रोलाजिन मोनस नहीं होगा क्योंकि क्रेटिनिन का उसका वो नहीं पहले ही आर्नी उस पे है लूप डाययूरेटिक एक रखना चाहिए डी मिडोडाइन है टू सपोर्ट जीडीएमटी और ई अर्जेंट क्योंकि ये उसमें है प्रोग्रेस में शॉक वाली स्टेज में था कार्डियक इंडेक्स 1.9 है मतलब लेस देन 2.2 तो या तो loop diuretic,
25 seconds.
Urgent heart
15 seconds.
We'll choose with C Charlie.
Okay, so you want me to lock C Charlie. Is that so? Okay, so as they say,
yes.
Lock C Charlie. And superb answer. Well done. You were using your logic, you were discussing it. Captain was leading the show and they came up with a wonderful stroke over long on. Beautiful 6. Well done indeed. Acute setting, you have to stabilize and all those things. So yeah, this is great thinking.
Hello Hamza, sorry to join you late.
Assalamu alaikum sir, great to see you. Yes, we were told that you were traveling and mashallah, great to see you.
With great difficulty, nice to connect. Yeah.
So this is the second semi-final and I just want you to know, you can hear me, right?
Yes, I can.
Okay, great. So second semi-final going on and we all know what was actually happening except for you. So Aga Khan University Stars, they've put up a great total 42 is the score. And now NICVD Kings, they have to beat this. Already 2 deliveries and 2 sixes. So a great match. All right, so we'll move further and we are going to have the third question. Can they have a hat trick of 6s on the third delivery, which is right in front of you? Go ahead and read the scenario and the question.
So next question is of which feature most strongly predicts non-response to CRT? QRS more than 110 milliseconds, high PVC burden, progressive LV dilatation with mid-wall LGE, ECV more than 30%, and frequent non-sustained VTs.
Okay, start the timer please, 60 seconds.
क्या कहते हैं QRS वहाँ पे तो कितना नॉन LLB यहाँ हाई एक नॉन रिस्पॉन्सिबल है, मतलब फायदा नहीं होगा. हाई पीवीसी बर्डन मेंशन नहीं किया कितना परसेंट है, और विथ मिड वॉल एलजी और ईसीवी क्या है. हाँ, मोर देन frequent non-NVT.
Approaching 25 seconds now. That's an off cutter. Can they negotiate this? 15. Come on, 10 seconds. Answer. 7.
C.
Which one?
Go C Charlie.
Okay, all I could hear was C and C Charlie. So yes, it's C Charlie that they want me to lock, and we are going to lock C Charlie. And that's a wonderful answer. Great stuff. It's a hat trick of 6s, and with this the score is 18 of 3 deliveries. Well, that's brilliant going. Oh, all guns blazing. Afridi in action, I would say. Well done. Okay, question number 4 coming your way.
So next question, which factor most increases his risk of sudden cardiac death? So first, non-LBB morphology, cardiac index less than 2.0, more than 2 myocardial segments containing mid-wall LGE, D, non-sustained VT burden, E, ECV more 36%.
Now, timer is on, 60 seconds.
B तो प्री शॉक है, लेस देन 2, मतलब इतना ज्यादा लो नहीं है, मतलब ना 2.2 से नॉर्मल तो 8 रिस्क होता है. C मोर देन 2 सेगमेंट्स, हाँ ये हो सकता है क्योंकि 36% एलजी है, और दूसरा नॉन सस्टेनेबिलिटी उसका भी परसेंटेज नहीं दी हुई कि कितना है.
25 seconds. 15 seconds. 9 seconds now, come on.
We're choosing C Charlie.
Okay, you want me to go with C Charlie?
Yes.
Are you sure about it?
Yes, as per scenario.
As per scenario, he says he looks pretty sure. So I'm going to lock C Charlie. Lock it. Oh my goodness, that's a wonderful stroke. That's a huge 6. And this one has been smashed.
Hamza, it's an excellent so far. They're playing an excellent ring.
Oh yes, excellent innings, and they're not dropping anything, and they are going all guns blazing, 4 in a row. They're really chasing it down. Oh goodness, stars, you need to pray from your stars today because kings are onto it. But you never know, we've seen a lot of interesting and funny things. All right, with best of luck to both the teams, we have question number 5 coming your way.
So most appropriate GDMT optimization given his BP and renal function. A, increase beta blockers. B, switch spironolactone to eplerenone. C, temporarily stops SGLT2 inhibitor. D, add vericiguat. And E, reduce ARNI dose.
60 seconds is all that you have.
Can we see the scenario?
Scenario, please bring it on. Scenario.
Heart rate. Heart rate नहीं लिया. QRS. No. बस ठीक. Okay.
Go back.
Yes. Increase beta blocker dose.
25 seconds to go. 15 seconds.
नहीं, reduce तो नहीं हो रही है ना.
10 seconds.
Yes, we'll go with D delta.
You want me to lock D delta?
Yes.
Are you sure about it?
Yes.
Okay, the captain seems to be pretty sure, and I think so is the team, the right wing especially. All right, so we are going to lock D delta. And what an answer! Another 6. Superb play so far. I think you're really making me excited, and all the spectators, the faculty as well. Great stuff. Superb stuff. So with this, it's a score of 30 already, I guess. Wonderful. 5 correct answers.
I'm so glad to be connected, you see. I'm so glad to be connected despite all the odds on the airport.
We can see that, sir. Your commitment is something which needs a salute from us. Brilliant.
सर आपकी बरकतों से चीजें और बेहतर हो रही हैं.
बिल्कुल बिल्कुल आपको सर पहले भी आना चाहिए था when stars were going उनकी बरकतें भी हो जाती ज्यादा.
मैं पेशावर एयरपोर्ट पे हूँ आपके शहर में हूँ.
Great, you're close to us, so it's always great to have you. And very close to ma'am, in fact.
सर मुझे मालूम नहीं है कि आप पेशावर एयरपोर्ट पे हैं. That's great.
Yeah.
Great,
Luckily,
sir.
the flight is little delayed, so I am easy to. I'm happy to continue.
Sir, have a great flight, and we look forward to seeing you, inshallah, soon, somewhere around this month, maybe. We are excited to have the finals also, and we're just one stroke away, we all know. And with this, we move to question number 6 now.
In Victoria, which subgroup gained the largest absolute benefit from Vericigot? A. Anti-pro-BNP less than 3,000. B. EF more than 30%. Recently hospitalized within 3 months. Normal systolic BP. E. Sinus rhythm cohort.
All right, 60 seconds are on your way now.
Which subgroup?
Can we have a second hat trick of 6s? Let's see.
नेट प्रो बीएनपी तो मतलब
ज़्यादा ही नहीं.
Recently hospitalized within 3 months. Normal systolic BP, sinus rhythm cohort. D normal systolic BP. किसको हुआ था?
This is the leg spinner now with a lot of revolutions on the ball. 25 seconds and now approaching 20 seconds. Come on.
Recent hospitalized within 3 months. नहीं.
10 seconds.
We'll choose C. Charlie.
Okay, so you want me to lock C. Charlie, and you look confident about it?
Not so sure.
Not so sure. You never know, you can have another hat trick of 6s. I think that's going to be brilliant if you do it. We are going to lock C. Charlie. Lock it. Oh my goodness! Superb! Oh my goodness, that's the second hat trick that you've come up with, and 6 questions, 6 deliveries, and wonderfully played 6 6s, a total of 36, and you are now in striking distance, just 2 correct answers away. Whoa, what great guns from you. All right, with this, we move to question number 7.
In Danish, which characteristic most reduced ICD mortality benefit? Age less than 50, presence of LGE, high anti-pro-BNP, D. CRT use, E. beta blocker therapy.
All right, so you have 60 seconds. Kings, Khan, chin up. Stars, you can still do it. I don't want to see you bogged down. The match is still on.
Characteristic most reduced ICD mortality. ICD लगाने के बाद mortality कम किसने की? तो हाँ. अच्छा.
25 seconds to go.
Most reduced LG.
15 seconds.
क्या करना चाहिए?
9, 7, 5,
will be beta.
Okay, so they say B beta. Okay, so with this, we are going to lock B beta and let's see what happens. B beta. Oh, that's the first mistake by them. Okay, never mind. You know, you are playing so well that this is your first mistake. So, you know, this had to happen somewhere down the line. The pitch is not that easy. But you guys, you're on it. Both the teams are really fighting it out. Okay, we have 3 more questions to go. And we're going to go ahead and move to question number 8.
Improve heart failure, which biomarker correlated most strongly with reverse remodeling? Reduction in his high sensitivity troponin with ECV decrease, reduction in NT-proBNP with reduction in LV-EDV, increase in BNP with LV mass increase, reduction in ST2 with improved LS strain, and reduction in galectin-3 with GLS improvement.
All right, start the timer now. Okay, can't hear the answering team. Yeah.
ECV, reduction in net proBNP with the reduction in LVDP, increase in BNP, LV mass.
So the slow bowlers are now trying to slow them down.
Reduction in galectin-3 with GLS improvement. Most correlated most strongly with
15 seconds.
We'll go with E epsilon.
You want to lock E epsilon. So how sure are you?
Yes, E. We'll go with E epsilon.
So you're confident about E? I'm locking it, E epsilon.
Yes.
Okay, lock E epsilon. Oh, that's another miss. Okay, are we moving towards another nail biter? This is what it looks like. Okay, Kings, you've got to play smartly now. You don't have any rooms now. You have to be spot on in the next 2 deliveries. You have to get them right in order to clinch it. So let's see what happens. Question number 9 coming your way. Okay, Agha Khan is back.
So next question, which trial supports continuation of SGLT2 inhibitors despite mild renal decline? Emperor reduced, DAPA heart failure, shift, paradigm heart failure, and SOLVE-D.
Start the timer, 60 seconds.
Mild, मतलब EGFR, हाँ, एम्प्रर है,
आई थिंक दापा वाला
ये सब वो उसमें सर मतलब जो SGLT हैं वो दोनों हैं वो है ना एम्प्रर हाँ लेकिन किस में उन्होंने कंटिन्यू की थी
25 seconds to go.
I think नहीं एक होता 25 में कर दिए दूसरे 30%.
It's a flighted delivery. Let's see what happens. 15 seconds to go.
We'll go with B beta, DAPA HF.
You want to go ahead with B beta.
Yes.
Okay, he says B beta. He wants me to lock B beta. Okay, lock B beta. Oh my goodness, that's the wrong answer. Oh goodness. With this, we are...
Nazar lag gayi.
Oh, nazar lag gayi, and you know, we've got 3 consecutive wrong answers. Okay, now it's a matter of survival for them. And they can draw if they come up with the right answer. So this last question again becomes extremely important. Kings, play very wisely, be very smart about it. You can still stay in the game. And we can move to the super over. So again, coming down to the wire, we move to the last question, maybe not, of this innings, of this match. Let's see what happens. Bring it on. Question number 10.
So next question, ECV ECV more than 30% or equal to on MRI best predicts which outcome? A. Response to CRT. B. ICD shock burden. C. Reverse remodeling likelihood. D. Diuretic resistance. E. Progression to stage D heart failure.
And the timer starts now, 60 seconds. So important for everyone. Oh, let's see what happens.
More than 30 or CRT correction. On MRI based which outcome? Response to CRT. ICD shock burden reverse.
"25 seconds to go. Everyone is silent and on the edges of their seats.
E.
Come on, Kings. 15 seconds.
E. Yes.
Which one? You want me to lock E? Epsilon?
E epsilon.
Oh, you want me to lock E epsilon. And let's see. Are you sure about it?
Yes. Progression to
Because,
stage.
you know, if you get this wrong, we know the outcome. Anar Khan, stars are through. If you get this one right, then it's a draw. And we are getting into, another nail biter, which is going to be the knockout stage, a super over. Let's see where we are and what happens. It is E epsilon. So lock E epsilon. Oh yes, superb! You are in the game. Well done.
That's interesting now.
That's interesting. You've gotten everyone excited here. What a wonderful match. I think it truly deserved to be a semi-final. And brilliant play by both the teams. And the pitch wasn't that easy, I can assure you that. Okay, so superb.
By
So
the
I
way,
think
Hamza,
we have the... Sir, your thoughts,
Hamza,
please.
You are always fond of super oval. So you got it, another one, you see.
I tell you, the technical team is not that fond of it.
So let's have the super over. I think they fought very well. Probably they became overconfident and made some mistakes. But then they leveled the score. So now it's anybody's game again. Interesting.
Very right, sir. Very right. So it's anybody's game. And I think we'll be ready once the technical team is ready with the questions. I think we'll have the start. Madam Amba, ma'am, your thoughts, please. What do you think is going on?
Thank you, Dr. Hamza. It's really interesting, and I endorse what Professor Ishaq Saab has highlighted. Because sometimes overconfidence definitely create problems, but both the teams are really well prepared for it, and we have really enjoyed it. Keep it up, but my advice to both the teams, it's just play. Each one of you are basically a winner for us, and good luck to both the teams.
Very right, ma'am. Sir, please. Sir.
You see, Madam Ashraf is very, very diplomatic. She doesn't hurt anybody's feeling. So that's an excellent remark that she gave. And I think both the teams are equally capable of winning. But I think one has to win. So let's see what the Super Bowl is. By the way, my name on this occasion is Xiaomi.
Yes, we can see that, sir, Xiaomi. And when you speak, Xiaomi comes up.
I don't know how to change it, but I don't want to take a risk of changing it now because we are at least connected with you.
It's all right, sir. We do understand. You know, we can hear your voice from miles away, and that's all we want. We want you and your voice. So it's great to have you. You are the catalyst which keeps us going in the true sense. And yes, ma'am Ambar Ashraf is always spot on with her comments, and she's been supporting everyone throughout, and it's so encouraging. Professor Abdul Hamid Siddiqui Saab, sir.
Somebody has corrected my name, by the way. Thank you very much.
I think I would also be diplomatic because both teams have done very well. It's just a stroke of luck luck that you answer an extra question and you become winner anyway. Very good scenarios, the first one and now the second one, very well formulated. It was in the first one, it was more a test of a memory and a major recall. But anyway, this is what the competition is all about. So let's see what we're going to see next now. It's a playoff, standoff.
Thank you very much, sir. Very right, very right. So
good luck for the team.
We have to be
Dr.
diplomatic.
Hamza?
Yes, ma'am.
Dr. Hamza, actually, we have to boost both the teams and encourage them. So I think I did it in that way because the match is on now. Okay, it's not a diplomacy, sir. I just want to motivate both of them so that we can enjoy another better inning.
So,
Assalamualaikum, sir. Can I have a word?
Feroz Saab, are you there? We've been looking for you, Feroz Saab. Thank you for joining.
I'm around, but you miss out sometimes. Thank you very much. I think a wonderful program. This was every day we learn from them. I think we learn a lot, and a good exercise. Or just अंबर वाली बात है कि winning or losing is not the real purpose of this program. The program is you are ambitious, you are working, and you have a sense of sort of participation and commenting and have an extra sort of जैसे मुकाबलाबाजी होती है तो उसमें आप सीखते हैं. So I think at this time the teams are both good. It was very difficult to decide कि हम किसको favor करें. So I favor both of them. My best wishes, good luck and congratulations, sir.
Thank you very much, sir. Both the teams have done so well. Heart, वो कहते हैं ना दिल जीत लिए हैं दोनों ने performance से. अब luck है कौन किधर जाता है. It's your luck where it takes you. But we are, they are already winners for us. And with this, we now get into the next stage. We are all ready for the super over. Teams, are you ready?
Yes, ready.
Yes.
Okay, so they are ready. And the same sequence will follow. And NICVD Kings will be throwing the question. And Aga Khan Stars will be answering. So bring the question on. And Kings, read it out. And everyone else on mute, please, now. It's getting serious. Okay, roll back. Okay, there was a technical error. Hold on. So we'll be back. Okay, just hold on. I think the technical team is getting it right. Technical team, just let me know when you're absolutely ready. So are we ready now? Okay. Read the question, please.
Which hemodynamic pattern most strongly benefit from TIR? A is low cardiac index with low pulmonary capillary wedge pressure, high pulmonary capillary wedge pressure with normal cardiac index. C is high RA pressure with low PA pressure. D is normal RA with high RVSP. E is equalization of diastolic pressures.
Okay, start the timer. You have 60 seconds. So it's sudden death.
Most strongly benefit करवाएगा टीयर में.
मुझे लगता है कि PCWP हाई है, पल्मोनरी प्रेशर ज्यादा है, MR ज्यादा हो रहा है ना,
हाँ.
तो उसको बंद करने से या फिक्स करने से फायदा होना चाहिए.
तो हाई से फायदा
हाई
होगा ना.
नहीं
हाई PCW
with normal cardiac index.
सही है. LV इतना कम इतना हाँ.
अच्छा ठीक है.
PCW तो ज्यादा ही होगा ना.
हाँ, मुझे CI नॉर्मल हो.
नॉर्मल कार्डिक
क्योंकि
अगर LV डाउन होगा तो फिर तो रिमॉडलिंग होगी फिर तो बेनिफिट होगा नहीं ना.
तो जितना डायलेटेड होगा ना
पल्मोनरी कैपिलरी वेज प्रेशर ज्यादा हो
ऑन कर दूंगा.
इंडेक्स नॉर्मल हो तो
Okay, so 20 seconds to go.
Beat नहीं
Approaching.
I think guys B
12 seconds. 11.
We'll go with B beta.
Okay, he always comes back and says B beta. Are you sure about this B beta?
Yes, after discussion, I think we're sure.
The team is on it. They've had the discussion. They want me to lock B beta, and we're going to lock B beta. And that is the correct answer. Superb 6 over the bowler's head, and I can see the victory dance. Not so soon, my friend. You have to still wait. So, great going. Well done. Well done. That's the spirit. The fist pumping, the dancing, and everything is going on. And just want to reiterate, it's going to be a super over, but it's sudden death. So one question apiece. Anyone who drops, he's out, and the other team goes on. Both drop, we move forward. Both get the correct one, we move forward. All right. So now it's King's turn. Can we have the next question on the screen? Go ahead, stars. Read it
Which
out.
statistical method best evaluated treatment heterogeneity in emperor analysis? Bayesian hierarchical modeling, mixed effects Poisson regression, restricted cubic spine modeling, D. Instrumental variable analysis, robust Cox proportional hazards.
Okay, 60 seconds. Timer starts now.
Treatment heterogeneity in emperor analysis. ए तो नहीं है, बी लग रहा है, हाँ मिक्स्ड इफेक्ट्स पेशेंट, हाँ, और सी क्या रिस्ट्रिक्टेड क्यूब स्पाइनल मॉडलिंग, डी इंस्ट्रूमेंटल वेरिएबल एनालिसिस, ई इज रोबस्ट कॉक्स प्रोबेबल, हाँ बी वाला लग रहा है मुझे, बी मिक्स्ड इफेक्ट, बी का.
You take your time. You've got 25 seconds.
Mixed effect patient regression. B.
15 seconds now.
B. We'll go with B beta.
Okay, so you want me to lock B beta. Are you sure about it?
Yes.
That's a mixed surety. Okay. Well, this is going to reveal where we end up. Are we going to the next one, or this is it? This will decide. And I'm going to lock B beta. Lock it. Oh no! No. I know I'm really heartbroken because I really wanted to move ahead, but you guys have been superb. You played so well. Kings and ICVD Kings were absolutely brilliant. And with this we come to the end, and I can see Aga Khan stars. They are excited, but they had their hearts in their mouths. I could see that. So now you can dance. You've played well. You've done well. Aga Khan stars are into the finals, and they'll be facing the Lions, the AFIC Lions, for the finale. Well done. But you know what? And ICVD Kings, you absolutely deserve every bit of it. And for me, I believe you are champions the way you played today. And absolutely superb show. I think Professor Ishaq Saab, I hope he's there. Sir.
I'm there. I'm very much there. I enjoyed the super over, and I think both the teams were equally capable and competent and knowledgeable. But when there are two teams in the field, one has to lose and one has to win. That's the rule of the game. So my congratulations to the winning team, and also I would like to compliment the loser. They're not loser, they're just runners, and they also played very well. Excellent fight. The questions were very, very pertinent, and one or two a bit difficult, but I think that's the way it should be. There are always one or two difficult ones, two or three easy ones, and the rest are average. So I think it was a very good fight. I missed the initial bit because of connection problem, but I enjoyed the rest of it. As usual, your moderation and the comments by Amber and Professor Hamid. So I think we are going to have an excellent next match, which will be the second semi-final, is it?
Sir, this is the second semi-final. Now we have the finale. The two teams are in the finals. They are in the finals, and AFIC Lions are in the finals now.
That's right. So I think we're going to discuss the ceremony when to be held. But I think waiting for the finale, which is going to be a very, very exciting time. So again, congratulations to both the team, and the winners are obviously on the top today. Thank you very much for having me. Enjoyed every bit of it. In the lounge, I was lucky enough because the plane was a bit late, which enabled me to complete the show. And I'm still, I think he just landed, so we have a couple of minutes. I can hear Amar Ashraf's comments and Hamid's comments. And Professor Firoz Memon is there as well today. So it's an exciting thing for us as well. I always look forward for this day and enjoy it. So well done, everybody. And of course, Hamza of Wilson's and other members of their team are to be complimented as well for their hard work and for this great innovation that they introduced in our academics. Thank you very much, Hamza.
Thank you very much, sir. Your comments are so important for us. And truly, we have to thank the airlines today for making it happen and making you available for us. So I think, I really thank the airlines.
Indeed.
I don't know whether it works for you or not, but it definitely worked for us. So
I
again,
was so
safe
glad
travels.
it was late. Thank you.
Right, sir. So have a safe travel. And yes, Professor Abdul Hamid Siddiqui, he's the second umpire. Sir, I think Siddiqui Saab probably is not there. And he has to unmute. Sir, you have to unmute, Siddiqui Saab. I think so. We have Professor Ambar Ashraf. Madam, your comments, please.
Thank you, Dr. Hamza. Actually, I think we are fortunate enough. Professor Ishaq Saab is with us. Whether what is the cause for it, hopefully, inshallah, he will have a safe journey.
Inshallah.
But that's what my feelings are. We are fortunate. Sir's umbrella is there with us. Heartiest congratulations to both the teams, and definitely the winners. They are lucky, and they must, along with their hard work, what I think they have a lot of prayers from their parents, and the good deeds they did, that's payback in this form. My suggestion to Wilson's Pharma and all the organizers, why not to arrange some prizes in the form of a national conference or something like this for the runner-up teams in both semi-finals as well, because in last week and now NICVT, both the teams did a wonderful job with their question answer sessions, and we really enjoy all that academic content. In the end, congratulations to the teams, the organizers who have formulated all these questions, hard work, the Wilson Pharma, the Junior Hamza for reminders, all the team members, and Dr. Hamza Hori, your moderation. जान डाल देती है सब चीजों में मजा आता है. Thank you very much. Stay blessed.
Thank you very much, ma'am, for your comments and for your appreciation as always. I think you are so important to this league. Your presence has actually made all the difference along with the rest of the faculty. And yes, extremely important point. Sir, Professor Saab is back.
Amber, डॉक्टर हमजा जो है ना वो तो जान डालते हैं इसमें प्रोग्राम में, मगर हमारी जान निकाल लेते हैं.
सर आप लोग बड़े तो रुए रवा हो इन तमाम काफिलों के, आपके बगैर तो कुछ भी नहीं है, और आप लोगों के होने की वजह से ना हम आगे इतने कॉन्फिडेंटली प्ले कर सकते हैं. अल्लाह ताला आप सबको जिंदगी सेहत के साथ रखे, मोहताजी से बचाए, हमारी गाइडेंस और दुआओं के लिए. जी
आमीन आमीन. बिल्कुल मैम, आप लोगों की वजह से ये सब कुछ है. हम यहाँ मौजूद हैं, आप हमारे टीचर्स रहे हैं और हमेशा रहेंगे. एंड आई थिंक वी हैव लर्नड सो मच फ्रॉम यू, फ्रॉम ऑल ऑफ यू, एंड दिस कीप्स अस गोइंग. एंड इट्स सच अ वंडरफुल कॉज दैट हैज़ एक्चुअली brought us all together, and it's the best form of academics you can have, with so much of fun. And credit goes to Wilson's Pharmaceutical for doing a wonderful job. Hamza and his team, of course, they get all the credit for that. We have Professor Feroz Memon Saab. Is he there? Okay, so I think he's not there, but we do have the coach of the winning team today. It is Dr. Jamshed Ali. Sir.
Alaikum. So an extremely nail biter.
Very proud of both the teams. They did very well. In the end, it was a matter of just one question. But I'm also very happy कि मेरी team अब final में है. So all the best. इतनी बड़े legends और teachers की presence में play करना और हमारा मौजूद होना ही एक मैं तो honor समझता हूँ. So thank you all the legends and teachers for being there for us juniors. And very proud of my team, very proud of the other team as well, and lots of best wishes to all of them.
Thank you very much, Dr. Jamshed. Congratulations to you and to both the teams. In fact, बिल्कुल सही आप कह रहे हैं कि हमारे बड़े मौजूद हैं, हमारे seniors मौजूद हैं, and it's their presence, their guidance, and platforms like these which actually make all the difference. So, can I have the two teams one by one? I would like to have the comments. NICVD Kings, are they still there? Kings?
Yes.
You are like kings, honestly. And I think that was an extremely important point made by Professor Ambar Ashraf. I think the organizers are there, they're hearing it, and maybe we can have a discussion on that. But the point is, wonderful play, and you are victorious today. I just want you to know.
Thank you. Thank you so much. I want to congratulate AKU stars. It was their day, obviously, and we are also not upset because we performed also well, but due to single point statistics, we don't follow actually. So that's why we couldn't pick it. But hopefully, inshallah, in coming years, we'll go through, inshallah. And thanks to Wilson Pharma for arranging this nice program, and it is very good for our learning. And also those who watches these programs on YouTube, they also learn a lot. So thank you everyone.
Thank you very much. It was a pleasure having you here. I think you are already a force to reckon with, and in the next season, I think inshallah you'll do wonders. So we are all waiting for that. We are waiting to see you again. So best of luck till then, and you were superb. Thank you very much for putting up the show. And we have the winning team there. Sir.
I think they can sum up by saying कि मुकाबला तो दिल नाता ने खूब किया.
बिल्कुल दुरुस्त फरमाया सर, मुकाबला भी किया और खूब किया. So बहुत खूब. Well done. Well done. So the winning team, Aga Khan Stars. Can we have the focus on them now? Captain, what's up?
Yes, we are here. So it was very exciting match. आज हमारी शाम में graduation ceremony भी है, तो our जो attention है तो वहाँ पे भी diverted थी. But और NICVD ने हमें काफ़ी tough time दिया. Hats off to them. But we in the end हमने वाकई prevail किया और we are very happy और माशाल्लाह. Thank you so much.
बहुत अच्छा खेले, very well done, बहुत ज़बरदस्त. I think one of the members, the light blue scrubs, he's missing. And I enjoyed his dance and his fist pumping. So
yes, he lives really far away. So शाम में graduation ceremony के लिए उसको अभी निकलना था. Otherwise we
okay. So congratulate him from my side as well, from our side, and we look forward to seeing you in the finals. So you've got a pretty tough team there, two of the toughest teams I would say, and I think it's going to be a great grand finale. Best of luck to you for that.
Thank you.
हमारे इनमें से 3 बच्चे आज माशाल्लाह ग्रेजुएट कर रहे हैं फ्रॉम कार्डियोलॉजी रेजिडेंसी प्रोग्राम. तो बड़ों की दुआओं के साथ इनको रुखसत कीजिएगा. आज इनका बस कार्डियोलॉजी का इख्तिताम होने वाला है AKUH के अंदर, and soon they'll be taking up the exams and their professional lives.
Mashallah, inshallah, all the prayers for them, and they'll do wonders inshallah. Professor साहब कुछ कह रहे हैं? Sir,
whether you know or you don't know, my career was split between Aga Khan and NICVD. I started my career from AKU. I actually founded the department there and then moved to NICVD, but remained on their faculty up till now and used to have my clinics regularly. So I think I have a great affiliation with both the institutions. Both are my institutions where I have spent years and years of my life.
Yes, sir. So I think this performance, it must be so close to your heart because your heart was with both the teams, both the institutions, and I think you can see how wonderfully they have performed today. Best of luck to both the teams once again. I think congratulations to the winning team, which is Aga Khan University Hospital Stars, and no commiserations, I would say. Congratulations to NICVD Kings for their wonderful performance. With this, we come to the end of this second semi-final. We now have the two finalists. We have AFIC Lions and we have Aga Khan University Hospital Stars. And that grand finale is going to be a treat for all of us. So with this, I think till next time, till the grand finale, we are going to sign out now. And it is so great to be with you people, with all of you, the faculty members, the teams and the audience. But, you know, we are extremely excited to be there in the grand finale. But till then, you know, we have to say Allah Hafiz to you and, you know, take care of yourselves, you know, keep working hard and do the best that you can do and be the best person that you can be in your everyday lives, because this is what actually matters. So till next time, till the grand finale, inshallah, see you and take care. Signing out.